Is exercise like strength training supposed to hurt? This video is going to cover what you can expect or what you may experience in terms of discomfort while doing exercise, with more of a focus on strength training, including what's normal and what instead may indicate an injury. I'm Dr. Elise Brown, and I'm a scientist who studies how exercise helps to prevent and slow the progression of diabetes. If you're new to exercise, especially strength training, you may not be familiar with different sensations in the body that normally happen during and after exercise. It's important to know what to expect so that you can better distinguish between discomfort that's typical versus discomfort that indicates something might not be quite right. Let's start with muscle pain. If you're feeling a burning sensation in your muscle during exercise, this is likely lactic acid. It is produced in higher levels in the body whenever we exercise at higher intensities that typically last between 45 seconds to 2 minutes. More lactic acid is produced whenever we do muscle building types of exercise. And strength training, this typically happens whenever we do rep ranges of 10 or more. After exercise, lactic acid levels return to pre-exercise levels, meaning a normal range, typically within 30 to 60 minutes after exercise. So if you're experiencing muscle soreness a day or two after exercise, that's not lactic acid. It's delayed onset muscle soreness, or DOMS. It's caused by exercise that you're not used to, or eccentric contractions, which is the muscle lengthening phase of an exercise, like the lowering of a bicep curl. The soreness is thought to be caused by micro tears within the muscle that happen during exercise. And while you're resting, this is when your body is healing those micro tears and restructuring. The most intense symptoms typically occur between 48 to 72 hours after exercise. If you're experiencing DOMS, you'll likely also notice a decreased range of motion, swelling, and weakness in the main joints and muscle groups trained in that exercise session. This is all part of the normal healing and remodeling process. These symptoms are going to be more intense with your first workout, but your body's going to adapt and you're going to experience a lower level of muscle soreness and muscle damage in future workouts. This is called the repeated bout effect, and it's been shown to last anywhere from several weeks up to 6 months. Now, if the eccentric contraction during exercise is extreme, this can result in an injury like muscle strain or tendon injuries. You can expect that this may have happened if you experience a sudden sharp pain while exercising and it gets worse with movement. This situation is likely some type of injury and not normal sensations that you would experience if you're exercising safely. You may also notice swelling, bruising, and difficulty using that part of the body. If this happens, you may need to seek medical attention. An injury can also be suspected if you feel any pain in the joints while exercising. If you're exercising and you feel joint pain, it's best to stop that movement and see a professional. Oftentimes, exercises can be either modified or substituted. That way you can still continue to work out, but in a safe way. Strength training actually helps to build stronger joints to prevent injury. But if there's already an injury present, we don't want to do further damage to that area. The general rule with joints is, if it hurts, don't do it. Exercise can also help to reduce pain during and after exercise. This is called exercise-induced hypoalgesia, and it happens in people with and without chronic pain conditions. It's thought to do this by activating systems in the body that produce pain-reducing chemicals, specifically the endogenous opioid system and increases in endocannabinoid concentrations. Another normal part of exercise that you may experience is muscle cramps during and after exercise. It's not fully understood what causes the cramping, but the scientific evidence so far points to multiple factors, including dehydration, electrolyte or salt imbalance, and unusual activity in our spinal reflexes. When I say spinal reflexes, think about the doctor tapping on the knee with a rubber hammer to test for reflexes. The muscle cramps are going to resolve themselves, but the research isn't particularly strong on how to actually prevent or treat these cramps that are caused by exercise. There's been some research that's found adding salt to water may help prevent cramping, and some that's found pickle juice to help resolve the cramps. Even though exercise may not be comfortable all the time, if it's done safely, it can help to prevent injuries that are caused by everyday life, and it can also help to reduce pain caused by chronic conditions. If you do have a chronic condition, it's best to have a conversation with your doctor before starting a new exercise program. Thank you for watching.